Hello and welcome to this week's episode of the Dadas Show, coming to you straight from the Boma Hotel here in Nairobi. I'm your host, Ashiko Mbune. The cancer burden is rising globally, exerting significant pressure on health systems at all income levels and populations as well. According to the National Cancer Institute, NCI, cancer is the third leading cause of death after cardiovascular and infectious diseases. Out of all the cancers, breast cancer leads in incidence with 5,985 new cases annually. That is 12.5% in all new cases. Every October, people all over the world show their support to everyone who has been affected by cancer. So we here at the Dadas are joining in that very worthy cause. So today we shall seek to understand this silent killer, its causes, its symptoms, its diagnosis, its treatment, and we shall also celebrate brave women among us who are living as breast cancer survivors. As always, we encourage you at home to join in these conversations by joining us on all our social media platforms at KBC Channel 1. Even though it's just a word of encouragement, even though it is a criticism, if it's feedback of any form, we want to hear from you. So before we jump into this particular topic, let's have a look at the following feature.
So my name is Agent Francis Angalia. I'm a 56-year-old cancer survivor. And for the last year, 7 years, I survived triple-negative breast cancer. And triple-negative breast cancer is very rare. It has less than 10% of women. And I got it at the age of 48. So the first mainly 2 years was really to battle with all this chemotherapy, radiotherapy, surgeries. I have had to date 8 surgeries to ensure that it goes. When the tumors come back, they are removed. I do chemo, 6 of them, radios, and then I proceed with management of the cancer so that I am able to survive. Because as I said, it's a very rare type of cancer and it's called triple negative because they don't know the cause. Yeah, I was actually suffering from scratching under my armpit because it's the left side. And every other time I would scratch and have this itchy feeling and wonder why. And I used to think maybe it's the clothes I'm wearing, the nylon, the heat. Pumbe, it wasn't. After a long time of like 2 years, is when I felt a node now. Before it was just scratching. And you think it's the heat. But then when I felt the node, now I got worried because, you watch October month, blah, blah, or the screening, the self-care. So now I started feeling, touching those nodes. Unfortunately, it was very late. It was discovered as stage 3B. When you already have the node, it means the cancer is leaving the breast and trying to find its ways in other parts of the body. But had I known 2 years ago, it could be cancer, the itching, then I would have gone for what they call diagnostics tests like mammogram, ultrasound, chest x-rays and all that. But I didn't know. So when I realized now there is something, and I went and I was told it's cancer. And not only cancer, triple negative. And not only triple negative, stage 3B. Stage 3B is usually quite advanced because cancer is stage 1 to 4. So you can imagine I'd moved from 1, 2, and 3B. And actually when it is here, the doctor was saying, I don't even know it is actually there. It could even be stage 4. It could have spread to other parts of the body. And metastasis, which I got last year, in the endometrium, the bladder, the pelvic nodes, and up my paraotic nodes, proved it was actually not just stage 3B. It had actually moved. And not only now this triple negative, they said they didn't know what is the cause. So there's a likelihood we are doing different specialized tests in Aga Khan and in India to check what was the cause of this triple negative, what was the risk factors. So far I've done several tests, BRCA1, BRCA2, I've done PDIL, and quite a number which show us showing that I actually also have ovarian cancer. And this is actually what is causing the cancer to spread around the body. And now it has gone to the bladder, it's been to the pelvic and the lower part of the vertebrae. Immediately they knew it was cancer, I was told I had to go through conventional treatment. That means I must go through a hospital, an oncology unit, get an oncologist, and there usually is 2. 3. There is an oncologist to give you the chemo. This is called a medical oncologist, like now Dr. Kierie. My doctor was Asim in Aga Khan, and another one in India later on, because after 2 years it came back, so I had to go to India. So these are medical oncologists for chemo. And then you need a surgeon, a surgical oncologist. So my breast was removed by Professor Asike twice, lumpectomy, and then later. Because when the cancer is advanced, you don't do major surgeries because it can spread fast. So first you do the lump, you remove it, and then after that, when it shrinks, you have a very short shrink, and the cancer does not have the strength to move around, then that's when now you remove the whole breast. So the whole breast was removed 2 years from the time of diagnosis, not immediately. The third oncologist is a radio oncologist. And my radio oncologist was Dr. Komen, and I'm grateful to these doctors because I was able to get 30 sessions of radiation. So after the lump was removed, these are beams of radiation, I think electrical and all that, so they burn. So what was not killed by the chemo and the removal of the tumor continues to be burnt, those cells, they continues to be burnt by this radiation. So then after that now, because I'm triple negative, I could not get the 4th conventional treatment, which is called hormonal therapy. And now in the recent past, they have a new one. It's called immunotherapy. So this hormonal therapy is a tablet you take for 5 years or 10 years, depending on what stage your cancer was, to keep the cancer in remission, so so the cells don't continue being active. That's hormonal therapy. And then there is also nowadays immunotherapy. So your body, when you have chemo, the immunity goes down. You don't have strength. You're not like just the other normal people. So it's risky to get infections, like I'm telling you. Like now I got chemo last week. I'm already prone to getting homa from wherever, or any other infections. So this immunotherapy protects your good cells, keeps the immune strong, so that these cancer cells which are around stops attacking your good cells. So those are now the 5 major types of conventional treatments which I went through.
So welcome back. Joining me today is a wonderful panelist of experts and survivors stroke warriors. I think I'm going to just refer to you guys as warriors from now on. You are your heroes in my eyes. So right next to me is Dr. Wanda Dulcie, who is a clinical and oncologist. Karibu sana. Next to her is Julia Kimani, who is a breast cancer survivor. Thank you so much for joining us. And next to her, we have Mwende Mutiso, who is a breast cancer survivor. And finally, amongst our audience, we have Madam Nancy Awor, who is a breast cancer survivor. Thank you so much for taking time out of your schedule. I know you have so much going on in your life to come and sit with me so that we can discuss in support of this very worthy cause. I also want to acknowledge my wonderful audience. Thank you so much for taking time from your busy schedules to join me on the Dadas show. So to get the ball rolling, Dr. Wanda, so we've described you as an oncologist. And I always like to say, common knowledge is not common to all. This is a term, oncologist is a term that is normally used in relation to cancer diagnosis and treatment. But for people at home who do not know what an oncologist is and what they do, kindly please expound.
So an oncologist is the doctor who has been trained to deal with non-surgical management of cancer. So once a patient has been diagnosed with cancer, then they deal with the chemotherapy, they're able to give radiotherapy, the clinical oncology bit. So we use chemo, we use radiotherapy and other targeted therapies and even hormonal treatment to deal with cancer. So our specialty as clinical oncologists focuses on non-surgical management of cancer, where you do not need to go do an operation, but you use medical management, hormonal therapy, targeted therapy to address cancer itself.
Okay, thank you so much. So if there are symptoms that are presenting themselves, then the appropriate doctor would be an oncologist.
Yes, pretty much it's a team effort, and we like to look at a patient from the multidisciplinary approach, meaning when a patient has signs and symptoms, we can guide the process. But in order to get a diagnosis, then definitely we'll need the input of the surgical team to either get a biopsy. You'll need input from the pathology team to look at the slides under the microscope to come up with a diagnosis of cancer. But yes, an oncologist can lead the process to the eventual getting of a diagnosis of cancer.
Okay, thank you. That's well put, Dr. Wanda. So when we are talking about the patients and the survivors, that's moving to you, Julia. Julia, thank you so much. And I have to commend you on your bravery to join us on the panel. And I want to thank you for your tireless efforts, you know, to just keep being here, you know, to keep striving day in, day out. I know you're an inspiration to many. Kindly share with us your journey.
Thank you for inviting me for this Dadas show. My journey began in 2020 January, when one Saturday morning, at the beginning of January, when I was just waking up in the morning and I was just exploring myself, the way you can just feel your body. And I felt like there's a lump on one of my breasts. And that Saturday morning, I thought about going for a checkup. Before then, every year I go for the screening, and nothing had ever been diagnosed. But this particular morning, Saturday, when that happened, I confirmed with my spouse, and he told me, yes, there's something. And so on Monday, first thing in the morning, I went to our clinic. I work in KBC Hospital, where they're also doing screening this month for cancer. So I went to the MCH clinic, where they told me, well, what we need to do is to do an ultrasound on that breast. So I went for the ultrasound immediately on that same Monday, and I was told you need to go and get a mammogram done, and then you'll need to do a biopsy, FNA. They told me about an FNA that time. So on Tuesday, I think the following week, same week, I thought to my knowledge that I should go for an FNA first, then go for a mammogram. The doctor will correct me, that wasn't the right plan to do. So when I went for the FNA, the doctors told me, no, we cannot do the FNA first, you go for the mammogram, because the results would be interfered with. So I went for the mammogram, and by Thursday, I already had been done the mammogram. Again, the doctor told me instead of doing an FNA, we are going to do a core biopsy. I agreed, and it was done. That's a week. The following week, on Tuesday, I got the results, which actually confirmed what the radiologist had said. Because when he did the ultrasound, he said, here, there is something, Julia, we must move with speed. So I didn't delay. That was confirmed again by a mammogram, and now here is the core biopsy that confirmed the same. Then our physician in KBC Hospital told me now we need to do some CT scans to confirm whether your chest, your abdomen, and all that has been affected, which was done. Thank God there was nothing. And the next thing was now to do an FNA on my glands, so that they confirm whether it has moved there, which they did, it was. And the next thing was the plan for the treatment. In KBC Hospital, you don't do the treatment, but we diagnose. So you are sent now to see the oncologists. It's usually a confusing moment, because first of all, it's shocking to realize that this is what you're going through. You don't know where to start. You see dark moments. You don't know where you're going to begin with. Of course, you break down, cry. And I thought maybe I should go to Texas. I went to Texas. I felt like they told me you need to go for chemo, then you go for surgery, then you go for radio. I felt I needed a second opinion, so I went to a Can hospital. I saw a breast specialist there who told me, well, we don't need to do that. We can do the surgery. Then you go for chemo. So I got a bit confused now. I went back to Kikuyu Hospital, where I saw a physician who told me, now I'll send you to another oncologist who is in Nairobi Hospital. I went to see her, and she told me what we need to do is to start with the chemo, then we'll do surgery, and then we'll do, that is now mastectomy, and then we'll do radio. Already I'm tired, because you're spending money.
I can imagine.
Everywhere you go, you're paying 2,000, 4,000. Don't forget about the diagnosis. These tests that are confirming one after the other, all of them are very expensive, because it's like you're doing the CT scans, the two, then you're doing the ultrasound, which is also expensive. Then you're also doing, I also did the core biopsy is also very expensive. The FNA is also, all of them are separate. And then I also had an MRI done. So all those are tests that are costing a lot of money. So by the time I went to Nairobi Hospital, I was already tired. And I already have a file that has formed with the results. And the oncologist there now told me we start the treatment, and I was like, we should have started yesterday by that time. So we started it, and I was put on chemotherapy, and I was told I would undergo 6 sessions every 3 weeks, and then after that I would get a mastectomy done, and then I would go for radiotherapy. So I agreed, and we started the treatment. It is a journey, even in the chemo treatment, because it has a lot of side effects. It's not friendly to the body. The doctor tells you it's knocking good and bad cells together, so your immunity level goes down. Feeding isn't very nice because you really don't want to eat, but you've got to force yourself. So it really has a lot of side effects. However, I went through the 6 sessions and finished them. And the next thing now was to go for the mastectomy, which again, as a woman, you fight with that. Losing a part of your body, and especially a breast.
A breast.
For a woman.
Is the key, for lack of a better word, key indicator of femininity.
Exactly.
Your breasts.
Exactly.
Yeah.
So it's something that I really fought with, but I didn't have a choice. I wanted to be well, so I had to go for it. And so it was done. And I really remember fighting with wanting to touch where they have extracted, where they have done it, and not wanting to. So I would ask them, have you finished? Yes. I don't want to touch to feel what they have done to me. And I think for the following 2 weeks or so, I didn't want to look at it or even to touch. And then I got well, I recovered from that. Then I had again to go for the radiotherapy sessions, which were 30 of them. I remember fighting with the doctor, asking him, must I go for the radiotherapy sessions? He said, remember, we had a treatment plan, which began with the chemo, the surgery, and then the radio. And then to make it worse, the doctor tells me you're going for 30 sessions. I'm like, wow, can't we reduce?
That is exhausting physically, mentally, psychologically, financially.
Yeah, it was.
So out of all this, what was the type of the cancer that was, it's breast cancer, but, I understand that there are various...
They say this is the hormonal one.
Yeah, this is the hormonal one.
Yeah.
Oh, okay. Oh, wow. Thank you so much. And of course, I have to commend you on everything that you have gone through and the fact that you're resilient and you're still here. So are you still undergoing the treatments?
Yes, after I finished the 30 sessions of radiotherapy, then they put you on drugs, on tablets that you take. The doctor will tell us more about them. They understand that better than us. But they told me I would take those drugs for 10 years. So there are 2 every day. 2 tablets a day. It's not a big deal. I got used to it already. So you take for the next 10 years. But every year, I've got to go for a PET scan to confirm that the rest of I'm still okay. I don't have any cancer cells anywhere.
Wow.
Yeah.
Wow, I think that's good. I think that deserves a round of applause, that's good. It's good to hear that you're healthy. It's good to hear that you're thriving. You are brave for everything that you did, endure. But before we move on to psychological impacts, Dr. Dulcie, she's actually mentioned the type of cancer. And personally, ignorant as it may be, it's only recently that I found out that there are different types of breast cancer. Would you like to shine some light on that?
So that's very true. We have what we call pre-invasive or pre-cancerous lesions. That's called ductal carcinoma in situ. So that is just before it gets to actually being cancer. And at that stage, we are able to do modalities that will ensure that we don't get to the cancer stage, prevention including taking hormonal tablets to ensure we don't get to cancer. Then we actually have the invasive type of cancer, which can most of the time is either lobular. The breast has lobules and it has ducts. So the lobules is where the milk is produced, and then there are ducts that are able to channel the milk. So breast cancer can occur in the ducts. Those are the tubular elements of the breast. It can also occur in the lobules. And when we're talking about invasive type of breast cancer, we're meaning this is a tumor that is able to invade tissues around. It's able to break off, enter into circulation, and even go to a distant area. Like perhaps it's breast cancer, yes, but you find it in the lung later on, or you find it in the liver, or you find it in bone. So that is the invasive component. And yes, even as we discuss invasive breast cancer, there are different types based on the hormonal profile. Some are hormonal sensitive, some are not hormonal sensitive. Then we have something called HER2 overexpression, which is a marker of the type of cancer you have and what it will respond to. We test that to enable us to know what type of drug can we give. There's a drug called Herceptin that targets that targetable mutation on the HER2 molecule. So yes, in invasive breast cancer, we have that. We also have Paget's disease. that begins at the nipple, where you have drying of the nipple, cracking, and sometimes ulceration that can also occur. And
Which
most
is
of the
also a form
time,
of breast cancer.
yeah, most of the time it is associated with an invasive lesion. So you see that on your breast, the crusting, the drying up of the skin of the nipple, and many a times within the breast there is actually an invasive component. There is the breast cancer. So it's good to look out for those signs. Then we have another one called phylloides tumor. Phylloides tumor can either be benign, meaning not cancerous.
Yes.
It can be intermediate, or it can be malignant. So one of the presentations of phylloides is rapid onset of growth of the breast. So you'd notice one breast is really growing very fast. And management for that most of the time is surgical. So you do surgery for that. So yes, breast cancer is not one disease, and I think it's very important for that to be understood, so that even if you have 10 people with breast cancer, they would not have the same management because of the immunohistochemistry. Is it hormone sensitive? Is it not hormone sensitive? What was the stage of the patient? And the management really is categorized based on those categorization.
Thank you so much, Dr. Dulcie. I think that's very eye-opening. I think everybody will agree to that, because there are different types of breast cancer, so there are different types of treatment and management. So it's not a one-size-fits-all. You know, we find sometimes people, because you do not want to do your research, you know that this person had breast cancer, so you'll take the same medication, etc. So we still urge people to ensure that you get the proper diagnosis, you know, by obviously visiting an oncologist, getting screened, and all that. We also have another breast cancer survivor. Thank you so much, Mwende. And you know, the thing that always stands out is because of how young you are. So I have a myriad of questions for you. But before we get to that, kindly, Mwende, you know, beautiful, courageous Mwende, share with us your story.
Thank you so much for having me. So my cancer story started in 2014 when I went to this medical camp, and we were taught how to do self-breast examination. And I remember at that time just thinking, okay, it's a skill I've learned, I'll just do it, but you know, I'm not over 40 years. And 2 years down the line, when I was doing my monthly checkups, I remember feeling a small thing, a small nodule in my breast. And at that time, you know, I got a bit shocked. You know, I checked, I asked my sister to come and check, she did. Sometimes we could feel it, other times not. So after about a month, 2 months, I went to the clinic to have it checked. And because, again, as you've said, because of my age, at that time I was 23 years old, with no history of any type of cancer in our family, and I'm the last born, so cancer was not something we thought it was. So when I went to the hospital, I was told it's hormonal imbalance and it will go away on its own. I went back home, the tumor grew a little bit bigger again. I went to a different hospital. So I spent about 6 months, give or take, and I went to 4 or 5 different hospitals. So the last one I went to, that's when the doctor told me I needed to now do the FNA, which Julia has talked about. The results were inconclusive. So I was told I need to do a core biopsy. And let me tell you, I was so great. Our family, we were so great about anything to do with cancer, and I didn't have insurance, including NHIF. So I remember, you know, looking for options, and we were advised, because the tumor was a little bit big, and again, because of my age, we were advised to just do a surgery and remove it, since, you know, eventually I'll need to, and it was cheap. So I decided to do the surgery. This was before diagnosis. The results came back. They showed that now I had what Daktari has said, ductal carcinoma in situ, which is stage 0 breast cancer, pre-cancer. And at that time, again, we didn't believe it. So we sought a second opinion. The results were the same. And because I had already done the surgery, I was now due to do radiotherapy. Flash forward, before I started radio, the doctor noticed that I still had lumps. So the surgery I did, because they didn't think it was cancer, was not done properly. And at that time, because I had, you know, a part of my breast had already been removed, it was either I do another lumpectomy, which is now the removal of the tumor and the surrounding tissue, and then, you know, do the scans and, you know, do chemo radio according to what the doctor would advise, or I do a mastectomy, the removal of the whole breast, and then I'll be on medication for 5 years, 1 tablet a day.
Yeah.
And because of the cost implications, and Julia
You think,
has
well, that
mentioned,
sounds better, yeah.
you know, and it's expensive. So I decided, you know, it's easier to do the mastectomy. I made that decision, I think, I was told on a Monday. I made the decision on Monday to do the surgery on Friday. Part of me was like, I need to do this and get over with it. I need to go back to my life, since I had just started university and I had just done 1 semester. So I wanted to go back to my life. And so once I did the mastectomy, I have to say, part of me at this particular moment, I always feel like I made that rash decision because I was afraid I wouldn't make it if I think about it for too long. So I did, and I was pronounced cancer-free after about a month. So I was on medication. A year later, that is when now things went a bit haywire, because my mental health was really bad. And I remember trying this dress with a cleavage, and I just realized, you know, I can't wear it anymore. So that is when I started feeling quite depressed, and I had to seek therapy. Initially, I had not gone to any support group because I thought, you know, quickly, I need to just finish, go back to my life. I didn't think it had mental effects, psychological effects on me. So I was on therapy for about a year and a half before I now started learning how to love myself again. You know, as you mentioned, you know, we have the idea that, you know, breasts are what makes you a woman, you know, part of what makes you, and that was me. And I had to go back to the drawing board and realize that, you know what, if I have 1 breast, 2 breasts, or no breasts at all, I'm still beautiful. Absolutely. Just the way I am. Absolutely. So I had to learn how to love myself again. So after about 3 years after now my first diagnosis, unfortunately I got a recurrence. Oh, no. And at this time it had, since the first time it was stage 0, so at this time it was stage 4, which Daktari will explain to us a bit more. But basically, the cancer had moved now from the scar, mastectomy scar, to one of my lungs and some nodes, cervical lymph nodes here. And when I saw the oncologist after my PET scan results came out, the doctor told me that I have 1 year to live. This was now in 2019, a day before my 27th birthday. And I remember just thinking, because I had already gone through this before, and unfortunately, one worry I think all cancer survivors and patients have is the fear of a recurrence. Like, it's always there, you always worry. So I did know it might recur, but I didn't think it would be stage 4, because with stage 4, it's incurable. You have to just manage it. So I was, you know, I left the doctor's office and just thought, you know what, I'm going to live my 1 year to the fullest. And I started a list of all the things I wanted to do. A bucket list.
Of the things that you want to accomplish in that 1 year of life that you have
within that 1 year. And well, right now I call it my dream list, because I always add on to it. And that 1 year was a roller coaster of emotions. Initially, I didn't want to do treatment. I didn't want to do chemo or radio, because I felt, again, you know, the financial constraints. You know, I was barely recovering from the first diagnosis. So when this again came, I didn't want to do it, to do the treatment. I was thinking, so to do chemo and then be sick, then die after 1 year, how about just live, then die? You know? I know. That was my thinking.
That's very YOLO of you.
Right? So, but the reason why I decided to do chemo was actually for my family, for my loved ones. And I started, I did chemotherapy, and after doing about 3 sessions, I already noticed some of the changes. The tumor which was on my scar had dissolved, the scans which I was doing regularly were showing good results. So I was like, okay, yay, I'm glad I did the treatment.
Yes.
And then, so fast forward, I'm telling you, one of the hugest challenges, apart from the mental health, are the finances. It's so expensive to manage cancer, and it's even more expensive to manage stage 4 cancer. So Dr. mentioned Herceptin. This is a treatment I was supposed to do every 3 weeks for as long as it works, to just ensure that the cancer does not spread to other organs. And one session is approximately 100K, 100,000. Insurance covers about the insurance I had anyway, covers 3 sessions. NHIF was covering about 3 sessions, and I needed 16 sessions a year. So the rest I was paying from pocket. And this is just Herceptin. There is the medication, there are the scans, which I do regularly. It was just crazy, and I couldn't afford, despite my family and friends and colleagues crowdfunding for me, I could not manage the treatment. So by the end of 2020, I stopped taking the Herceptin. So I was now on medication. And I remember one of my fears was, this cancer going to a different organ, So whenever I did the scans, I was, there's this cancer anxiety. You have, scan anxiety, which you're not sure what the doctor is going to tell you. So at that time, since I knew I had done all I could, I started doing, I've been doing research most of the time I've been on this diagnosis, but now I started going a bit deeper to see, okay, what else can I do to supplement whatever I'm doing? I researched, I went on to a plant-based diet for about 4 months, and to just ensure, to support my body.
At least your immunity.
Exactly.
And so where are you? Where are you right now?
So now last year when I was doing the PET scan in June, the results came back and I was told they can't see any sign of active cancer in my body.
That's wonderful. Oh, wow, look at that smile. That's wonderful news, Mwende. And we have one final, I wish you would be able to bring in all the warriors and all the survivors, everybody in one room, but we can only be able to have a number. So we have one more who is seated with us in our audience. Her name is Nancy, and we'll give her an opportunity to share with us her story. Nancy, karibu sana. Perhaps you give us a little bit, tell us a little bit about your journey.
Okay, mine started in 2016. When I just felt a lump on the right side. So when I felt it, first I ignored it because I didn't know that it's what. I didn't know about cancer. So I ignored it. So at times when I bathe, I feel it. Then I continue ignoring it. After 2 months, so it started growing big. So I noticed there is something. And I was feeling a bit sharpness or pain. But mostly cancer does not pain. So when I went to the hospital, they did the FNA. It didn't show anything. I went for mammogram. It didn't show anything. So the last one was a biopsy that came that I had breast cancer stage 2. So that's where the journey started. Because when you are told it's cancer, you don't know about cancer. What you know is that when I have cancer, I have to die. You don't know what the family will take you for. Mostly, if the family hears that you have cancer, what they do is just, some people just think that it's a curse. Yeah. Some people just think that there's something you did. And there's something like in our family, somebody asks you, where did you get it? Is it a lifestyle or what did you do? Do you have it in genetic? But mine, it was not genetic. So when I started the journey, so the doctor told me you have to start with the surgery first. That's what I started with. So after the surgery is when I started chemo. But I didn't go for radio. The doctor knows mine was triple negative, but it was aggressive. So that's where the journey started. So you know the stigma about the family. You find some people now, they don't interact with you. So you feel you are alone, maybe only the close family members hao ndio watakuwa na wewe. So when I started with the chemo was very horrible. The side effects, you don't eat, you lose weight. So when I started the first chemo, I did it, then my blood dropped down. So I could not do the second chemo. So I had to be transfused. So then that one took another 3 weeks, 1 month. So is when I started another one. So I went through about, they were 9, then the doctor told me to do 8 because I was not going to do the radio. But now from there, the journey has been that way. So I finished everything. Now I'm a survivor. So even those people who stigmatize, they can see me, I'm alive, and I think that I'm looking good better than that. So the problem that was there when you don't have a breast, now somebody looks at you, because I didn't know that you can put something. I was just walking that way. At times it makes you go crazy. Maybe even if I'm going to the shop, so people just look at you, hey, what's wrong with this woman? Ni nini mbaya? So many people don't know that somebody can lose breast. Now somebody thinks, ask you, were you born this way? How can you feel? No, I was not born this way. What happened? At cancer. What is cancer? So many people doesn't know about cancer. So what I'm saying, the awareness should be done about cancer, so that people should know this and this can happen. Know that if they see you, they don't know what's going on. Yeah.
Thank you so much. I think Nancy deserves a round of applause. You know, that's the least we can do to encourage you on your journey and how you're going, and to just pray that you keep at it, you know, be as strong as you have been till now. And of course, what is resonating, which we will dig a little bit into after the break, is the lack of awareness. You know, the stereotypes that are all over the place. And thank God for October, which is breast cancer awareness month. And we hope that this is a global movement. Of course, it's already a global movement, but we hope that Kenyans and anyone who's watching this show can be able to take this seriously, to educate themselves. But we'll find out that more after the break. So let's take a short break. We'll come back to the question and answer session. Welcome back to the question and answer session, the segment of the show where we get to know what the audience are thinking, and they get an opportunity to actually interact with the panel with their set of questions that they have picked up throughout the conversation. So to start us off on this particular segment is Fanwell. Fanwell?
So my question is directed to Julia. I would like to know how much awareness is there on breast cancer, and are there like support groups for women living with breast cancer?
I would say about awareness, I'll say a small yes and a very big no. The small yes is because we are given the October month as the Cancer Awareness Month, which is global. And why I'm saying a big no is because people still do not know that that is a window that is opened for their screening. I work in PCH Kui Hospital where we are doing screening in this month. And a lot of days you'll find that very few patients turn up for the screening. And I think it is because perhaps the awareness is not done so well out there. Because I would expect that when people know that you can go for screening, which can prevent a further problem in yourself, you would go for it. So I think there's still much more to be done to the public, because if it is done, then we'd find a lot of numbers increasing in the screening. Because I think a lot of centers are offering the screening in this month, but the numbers are very few. And that must resort to an awareness of the screening that is going on. About support groups, they're there, and there are quite many. Personally, I don't belong to a support group. I chose not to, for some reasons of fear. Someone told me that sometimes support groups, when you're in so many, and you find that someone has succumbed, it scares you. So me, I felt like, no, I don't want to belong to any. That is me. So I went through my treatment, I finished, and even today, I'm still there. A lot of people, I talk to people, even one has cancer, I normally go see them and encourage them that they can be well because I am well. They just need to be positive about the treatment. And I have seen a lot of people who have survived and they are well.
Thank you so much. That is really well put, Julia. Thank you so much. The next question that we have is by Sharon.
I would like to ask Daktari, does the government support the initiative, the breast cancer, the process, the way they are saying it? Can you let us know?
Previously, if we talked about 10 years ago, we were talking about just 2 facilities offering cancer treatment. That would be Kenyatta National Hospital and Moi Teaching and Referral. And if you needed radiotherapy, then it would mean if you're using government facilities, you just need to come to Kenyatta. But the government has done quite a bit. One of the challenges is that there were few oncologists. So the government saw that need and started a program in collaboration with the University of Nairobi. So we actually have a local training program for oncologists, and currently they're in the 4th year. So that means you're going to have a larger number of oncologists, meaning more access to the oncologist, so that you don't have to travel so far to get oncologists on site. So that's the training aspect is being done. And it's not just for doctors. We have nurses who are being trained as oncology nurses. We're having radiotherapists. We're having physicists being trained, just to ensure the whole spectrum of the training is being handled. Even for surgical oncology, there are programs that are in place to help with that. So secondly, there's been decentralization of these oncology centers. Currently, the government itself has Nairobi as a Kenyatta National Hospital. There's Kenyatta University Hospital that has radiotherapy and oncology services. Mombasa recently started having radiotherapy. Nakuru has radiotherapy services and oncology centers. And it's a regional center, Mombasa. And that sort of helps to make patients not travel too far. And each center is equipped both with chemo and radiation. And those are the centers I've just mentioned: Garissa, Mombasa, Nakuru, KU, and Kenyatta Hospital are government facilities. So that means the cost is quite affordable to the patient as compared to private facilities. The other thing, 10 years ago, perhaps or more, NHIF was not giving the support we're seeing currently. So NHIF has actually given a lot of support to oncology, in the sense that if your chemotherapy is every 3 weeks, most of the chemos are about 6 sessions or 8 sessions, and NHIF is able to cover that based on the regime for first line. For second line, they are also able to cover up to a certain amount depending on the drug you're taking. And that's a huge stride, because you can imagine if somebody is paying 6,000 and NHIF can pay for you 25,000 every 3 weeks, then that means they've done a good deal. So it's making access. Patients who would previously not be treated are getting access to care.
I think that is really well explained. So we will have the next question from Faith.
I'm going to pose my question to Daktari. I wanted to know, what are some of the signs and symptoms of breast cancer?
That's a wonderful question, because we need to know what to look out for in order to make the decision to go to hospital. So one of the things I always emphasize is you need to know your breasts. You need to be familiar with how your breasts look. That means a mirror and you standing naked in front of the mirror, so that you know, how do your breasts look? Are they the same size? What is the normal? You need to know how they feel. For women, we need to know how they feel before your periods, during your periods, and after, so that you're able to know what is the consistency based on the time of the cycle you're at. We say the best time to feel for them is after your menstrual cycle, and that would really help you know what is your normal. So once you know what's your normal, you can be able to tell what's not normal. So one of the things to look out for, yes, definitely the breasts are not the same size, but if you notice what your normal is and one breast has become slightly larger than the other breast, if you're feeling a heavy sensation, if there's any, you're feeling uncomfortable in that breast, either pain, irritation, your nipple is cracking, it's become white, you're having what is called dimpling, peau d'orange. That means, you know how an orange looks like it has holes or dimples?
Yes.
So if you have your breast having that dimpling, it's something of concern. Most of the time, nipples face outwards. So if you notice one of your nipples is retracting, it's like it's being pulled on the inside, that is something worth of concern. If you palpate and you feel there's a lump, then that is also something you need to look out for, because then you need to go to a hospital so that a clinical breast exam is now done to confirm whether what you're feeling is right. It's also important to pinch at the nipple. If there's any discharge, you're not breastfeeding, but there's a bloody discharge or there's a discharge coming out of your nipple, then that is something of concern. And when you're talking about breast examination, feeling your breast, this applies both to men and women, because even men have breasts. I'm sure many men are thinking we do not have breasts. Yes, we do have breasts. And it's important for you to know how your breasts feel. And if you notice any difference in the size, notice any lump, you notice any ulceration, and I'm glad someone brought it up. Cancer is not painful. Majority of the time it is painless. So it's important for you to feel it so that you can be able to tell the difference. So what we do advise is that you use the palm of your fingers.
I want us to slow down so that everybody perhaps in the audience.
It's going to be interesting. You use the fingers.
The fingers?
Yes, not the tips. You're not going to dip through the breast. You're not pinching through the breast.
Yes.
But you're sort of making it firm and straight.
Use the fingers?
Yeah,
Members
firm
of
and
the audience?
straight. So your breast, you divide it into 4 quadrants. So that you're able to make sure.
And it's the opposite side.
Yes, so this hand will look at this side and this one will cater for this side. So with the hand straight, you're going to push your breast right into your chest and you're going to make circular motions so that you're trying to feel if there's something you're pressing onto the chest wall, so that if there's a lump, you're able to do that. So you'll repeat that sensation going through the quadrants. Remember, part of your breast goes under your armpit.
Yes.
So as you examine, you're going to examine under your armpit and also feel if there are any lumps in the armpit, because the lymphatic system go under the armpit. So you'll go around all the 4 quadrants, and then you'll finish off with the central quadrant where you press towards the chest wall to feel if there's any lump. Remember, we said you need to check whether there's a discharge. So you'll also pinch your nipple and see if anything is coming out. Remember, we said our breasts as women, they feel different, the different cycles. So it's good to know what is your normal. What does your breast feel like? So that if there is a change, you're able to know the change has occurred.
So our next question will be coming from Aisha.
How did your peers take when you had a vasectomy, being a young lady? Plus, how did it affect your dating and social life?
This is a question I tend to be asked quite a lot. And, you know, when I got the diagnosis, I was neither married, I'm still not married, and neither did I have a child. Well, I still don't have one either. But at that time when I got my both diagnoses, I was dating somebody. And unfortunately, the relationship ended by end of 2020. So after that, of course, I have gone for dates, and it's one of the challenges I was having initially, because I was wondering, so during the first date, is that the time you're supposed to tell somebody, listen, I have one breast and I have stage 4 breast cancer? So I think what helped me a lot was now, you know, first loving myself as I am, so that when somebody decides, hey, it's too much, I can't, you know, I won't take it so personally, you know. So it has been a roller coaster of emotions, you know, in terms of also how I relate to my peers. I did lose quite a number of friends, because when you're doing treatment, for example, you cannot socialize as you used to do. You know, there's the fatigue, there's, you know, the depression which creeps in. There's a lot of things which are happening. And I have to say, one thing which really supported my mental health was my support system. And this was my family and my friends, I think people around me, because you cannot do this alone. Honestly, you can't. And there's no one out there who I've seen who has done it alone. I think it's key, it's very important to have a strong support system. And this also means that, you know, the people who are around you, as much as they are supporting you, since they are also getting this secondary trauma, you know, a cancer diagnosis is not just for one person, but for the loved ones as well. So they also need support. And that is now where the support groups come in. And because of my age, I did know quite a bit about some support groups, but I didn't feel like I fitted in. My age, I wasn't, I wasn't a family person in terms of I didn't have my own family. So some of the challenges I was going through, as much as the next person who has breast cancer had the similar challenges, they were not the same. And through that, what myself and my sisters decided to do is start a support group called Chasing Hope. And this not only gives now the psychosocial support, but our key aim is to now reach the youth, to show them that, you shouldn't deal with this alone. There are some other people who are still going through this, and they are living their life.
We are going to go to the final question of this very, insightful episode, and it's going to come from Cynthia. Cynthia?
Yes, my question is to Daktari. So we hear various stages of cancer, stage 1, 2, 3, 4. Could you expound on each and also what to look out for in each stage?
That's a good question. It's the first question every oncologist gets, either from the patient themselves or from the family that wants to know what is the stage. And I think the connotation that most people have, I think everybody knows there's stage 1 to stage 4. But most of the people imagine when you're termed stage 4, then that means it's a death sentence, or it means that's the end of life. You've reached the end of the numbers. However, the most important thing to note, and what I try to encourage family and patients to understand, is that for us, staging has to do with the size of the tumor and where it has gone to. So for example, stage 1, then the size of the tumor is small. It's confined within the breast. Stage 2 is a tumor that's slightly bigger, like 2 to 5 centimeters. Stage 3 is more than 5 centimeters. When we get to talking about stage 4, then we're talking about part of the tumor breaking off and going to another site, either the rib cage, which is the bone, going to the lung or the liver. But it's good to know that cancer management is very individualized. Stage 4 has a variety of patients. You have a patient who's stage 4, they have a very small breast mass and one lesion in one bone. But you can also have a person who's a stage 4 who has quite bulk of disease. So the management is really tailor-made on the patient who is before you. What is the stage that they have? What are the other conditions they have? Do they have hypertension, diabetes? What are the other comorbidities that will affect the treatment you want to offer them? So really, we do not look at stage in isolation when it comes to management. However, maybe just as a broad statement is that early disease, most early diseases, stage 1 and 2, then we are thinking more of perhaps a more surgical outlook to the tumor, because the tumor is small and can be removed. But it's not a blanket statement, because we are looking at what is the type of breast cancer. Is it triple negative? Is it hormone positive? What is the age of the patient? Are they old? Are they young? What is the nodal status? So just to break it down, cancer is not one disease. And it's really important to have that conversation with the oncologist that is before you to understand what does the patient have and what is the way forward for that individual patient, not to have a blanket statement that all stage 2s get this kind of treatment, or all stage. That would really be false and misleading.
I feel like it was such a blessing to have Dr. Wanda and how she explains everything, that a layman like me, I can completely understand everything. So thank you so much. So we've come to the end of another very interactive, informative, insightful, encouraging episode of the Dadas show. I want to thank my wonderful audience and the participation that you have offered, the questions that you've asked, the opinions that you have seeked, even during the commercial breaks, the words of encouragement that you've shared with all of us. I want to commend my warriors for the journey thus far and for the journey that you will take from here on. I wish you nothing but the best, in your treatment, and I hope that we have this conversation another time as we celebrate the milestones that you have been able to overcome. Thank you so much, Nancy. Thank you so much, Mwende. Thank you so much, Julia. Of course, thank you so much, my very learned friend right here, for expounding on so much information. And I know everybody, even you at home, feel like you have understood something more about this silent killer, which is primarily what the main aim and objective of the show was. So My final and parting shot would be, and the words would be, there are millions of women who are fighting a battle with breast cancer and hundreds of thousands more who are diagnosed every single day. It's actually time for us to spread awareness and to break some of those myths and to educate people about this disease. For the women this particular month, we encourage you to get screened. Go and get checked. Go and find out. Let's not be the proverbial ostrich where you put your head in the sand and say, if I do not know, it's not going to kill me. I'm sure there are many people who would want the opportunity to turn back the hands of time. So now, here right now, in the presence, in the present that we are in, take a proactive step. Go and join a support group, even though you're not a survivor or, a victim or a member of the family, to just offer a helping hand. And for the likes of Mwende, Julia, and Nancy, and other brave warriors at home, keep sharing your stories. I know that they reach far and wide to encourage and to remind others that they are not alone. Let us all rally around members of our community who've been afflicted by this silent killer in one way or another, be it through a family member or be it themselves. Let's rally around them. Let us support them. So on behalf of my production team here on KBC, and also on behalf of my location partner, the Boma Hotel, my wonderful team that is here and back in studio, we want to thank you so much for tuning in this Sunday. We will catch you next time, same place, same show on the Dadas show with me, Ashiko Mbune. Until then, bye-bye.